COVID-19 is that the new cosmic season arrived in China in Wuhan province. It was the acronym to coronavirus 2019 disease that penetrated among people to separate them until everyone hid from it behind the masks. But the home quarantine became its a title, and despite the isolation law, injuries increased and the death rate increased. But the health world did not get bored and does not stop at a disease. Research and medical scientific development accelerated to save the humanity. The new strain of COVID-19, it's like SARS-CoV-2. The characterized by the rapid spread of infection and its ability to develop its genes into disease genes faster in the air droplets and the surface are transmitted between the human and the animal. COVID-19 can cause mid to severe symptoms. Most common symptoms include the fever, coughs, and shortness of breath. But the other symptoms may include sore throat, body ache, headache, gastrointestinal, and loss of smell and taste. As it led to severe respiratory distress and heart failure and kidney failure and hepatic failure. Some heart winners sometimes suffer from heart palpitation and shortness of breath in some cases. The demand for cardiac oxygen increase led to hypoxia caused by a weak respiratory system resulting in damage to heart muscles. In addition to causing convulsion and headache for the patient because its effect on the control the nerve capacity through its transmission to the central nerve system through the olfactory bulb. It is more harmful to the nerve system in the auditory, how is severe from the pre-exciting neurological symptoms such as Alzheimer's disease. The test that used to determine if a person COVID-19 that positive is RT-PCR. The disadvantage of RT-PCR test, it is a time-consuming complication and low-resolution manual process. So, the medical staff use of the X-ray also has necessary advantage over traditional diagnostic tests as the cost of the imaging is acceptable for the patient and the patient exposure dose is lower than a CT scan. So, the projection overview for the chest COVID-19 is a lot, but it's the basic posterior anterior and the lateral. The posterior anterior view, it's like that. The X-ray tube is here and the patient is erect and facing the cassette and the beam is perpendicular and penetration the patient from the posterior to the anterior. Now the lateral view is also erect but the X-ray beam is penetrated the patient from the left side to the right side perpendicular to the cassette. In these cases, two male and 41 years old present with a fever, we take the PA view and the lateral view and seen in the X-ray profile a white opacity. That means a positive with COVID-19. In various of radiographic cases, we see a negative or the positive. That's a different result between the X-ray and PCR because the X-ray rapidly factor in patients with advanced cases due to their increasing rate of viral infection. That the natural of the X-ray is theoretically based on the two dimension. Also, the difference in the volumetric cavity of the patient causes a change in image quality in the chest area of the adult patient of medium and large size. Because the natural of the photon that penetrated the body penetrate the layer of the complex structure of the body organ and bones, some of which are observed by interaction and other without interaction inside the body. This means that the rays penetrating several layers to access the future of the photon to form the radiograph, the quality of which depends on the different radiograph factor from the patient another to the patient. The conclusion of this report. Model performed remarkably well is detecting COVID-19 cases for the binary category mission. Dark COVID-19 model successed in discovery of COVID-19 finding. However, X-ray still faced many difficulties in developing the visual vision of human body, and their diagnosis of COVID-19 is limited to very advanced cases. So the presence of many smart devices such as a computer tomography CT scan that facilitated the diagnosis process, even if it's a dose that expresses a double, but is determined the fate of the patient in such epidemiological cases.